Since I made my previous recommendations, I have been watching local and international data closely, and 2 items have emerged that have led me to recommend that we adjust our approach and defer the changes originally scheduled for August 16th. First, current non-ICU hospitalizations in our province are trending somewhat higher than we anticipated. Our initial modeling showed that at this time we would expect to have about 90 total cases in hospital. Compared to 146 cases in hospital today, this is an increase of 62% over our projections. To be clear, there is no issue with hospital capacity. Anyone who needs treatment will be able to get it, either for a COVID-related illness or for an unrelated issue. However, it is important to take some additional time to monitor the situation. Second, we are closely watching the emerging evidence from the United States about pediatric cases with the Delta variant. The experience in the US has been different from the information from the United Kingdom, which we used to inform our original decision. In the UK, the Delta variant did not cause a different experience in children than previous COVID waves. Children under 15 remained the lowest risk of severe outcomes from infection. In the US, unfortunately, hospitalizations in children have started to rise, most significantly in states with lower overall immunization rates. It seems most likely that the reason for the difference between these 2 settings is the level of adult immunization, which is protective for children via reduced household and other community transmission. In the UK, almost 75% of adults have received 2 doses of vaccine, while in Florida, one of the states where high hospitalizations have been reported in children, only 60% of adults have been fully vaccinated. In Alberta, at just over 67% of the eligible population fully immunized, we are in the middle of these 2. Given this emerging evidence, I want to further monitor these trends. I do not share this information to cause alarm. To date, we have not seen a similar rise in severe cases in youth here in Alberta. Since July 1st, we have only had 7 cases in hospital under the age of 18. However, it is important to monitor our trends in a consistent way and to continue to require cases to isolate while we do so. Based on these developing factors, I have recommended that we pause the next step in our transition for a period of 6 weeks until September 27th. Not only does this allow us to do further monitoring, it also gives us more time to increase vaccination levels, which is the #1 most important thing adults and older children can do to protect themselves and younger children and others around them.
While schools will not have to follow last year's measures, they will still use good health practices and follow certain health guidelines. Students will return to in-person learning and many activities with no restrictions, consistent with the extended timelines for easing COVID-19 measures that Dr. Hinshaw just announced. Students and school staff should screen daily for core symptoms and must isolate if they have the core COVID-19 symptoms or test positive. Although masking will not be mandated in schools, it will still be required on school buses until at least September 27th. A detailed 2021-22 school year plan contains 2 contingency scenarios for continuing student learning if there is a significant change in the COVID-19 situation. Measures like cohorting, masking, and spacing will not be required, except in an outbreak situation, which Alberta Health Services will determine with our schools. And everyone who wants to wear a mask must be supported to do so. After all, we all need to make choices based on our individual situations.
We really have to stop treating COVID like it is the only and most significant risk for our children. We know that other respiratory viruses can also cause severe outcomes in kids, and part of the shift that we are making is to support a sustainable transition that can help schools look at when they're having these surges in absenteeism, that there's a response that's appropriate to help not just with COVID, but other respiratory viruses. And again, the The required isolation that will be continued up till September 27th does not include required quarantine for whole classes. We recognize that intervention, which I believe was necessary last year prior to widespread vaccine availability, that is highly disruptive and causes significant harm. Right now, only about half of youth 12 to 17 are fully vaccinated. Providing vaccines through school ensures vaccines will be accessible to all eligible school-aged Albertans in the province. By continuing to get fully vaccinated, following recommended guidance, and managing outbreaks, together we can support children safely returning to school this fall. We have been through a lot in the past year and a half, and our kids' lives in particular have been profoundly changed. COVID has taken a lot from them by the impacts of the measures that we have needed to use to protect our communities. However, vaccines give us the chance to change that.